Good evening. Hi, Cubby. Please remember to subscribe. Yeah, spelling. Please. Please. Thank you. Hi. So it's April 8th, 2020. It's around 5:55 in the afternoon, evening. There's still light out, so I guess it's you can't call it evening yet because it's not dark yet. So, but we'll call it afternoon, evening. So it's Wednesday, and this is the third or fourth in the series that I'm going to do during this COVID infection. I'm going to go live. If I can just adjust this light just for a second, a little bit. No, wrong adjustment. So, wow. Yeah, that's even worse. Maybe I can turn it off. Eesh, that's a bit spooky. All right, I guess it'll be like this. So, update. So, what's going on? So, around the world, 1.5 million cases so far. And I think, I don't even remember how many had died, perished, may they rest in peace. And God have mercy on their souls. Around the country, it's still the same. New York is still leading the pack, which is a race you don't really want. A lot of cases and a lot of deaths still. California, it's still about the same, still trying to procure equipment and ventilators, but I think the governor's been able to acquire over 500 million masks, I think. So LA County wise, the clinic where I work, they have just been put in the news by one of the employees regarding reusing masks, which is contrary to a lot of our, like Joint Commission, OSHA, and so on. So, I guess there's a lot of fear and panic going around. So, which is to be expected. But I think I think anxiety is good, but panic isn't too helpful. So today I actually had and she actually is a second year nurse practitioner student from UCLA, and she actually works at Olive View, which is a county facility. And I tell you that because I want to say a little bit about what's going on in her school. So I'm actually precepting two students, one first year, one second year. So this young lady is actually second year, and so she had, like I said, texted me yesterday saying that she was coming in today. She came in today, and we pretty much just talked and kind of toured a little bit what the screening room, and I'll tell you a little bit more about that if I remember. So about school, so she's telling me that where she's going at UCLA, pretty much the first year students were told not to go to clinical because they're going to reserve all of those locations for second year. As it turns out that a lot of second year students, a lot of their clinical placements were canceled. So they're not, I'm just going to adjust this real quick. So they're not doing clinicals, which is actually very important that they have at least 500 hours of clinical time. So, but according to my student, she was saying that most of them have actually have accomplished that. So she was actually very appreciative that she's actually able to go and precept with me because nobody, excuse me, I guess a lot in her class have no placement. So she was actually feeling happy and thankful, and I told her, well, I didn't really have a lot of patients today, and but while she was there with me, my RN said that there was somebody who got scheduled, who were actually going to schedule for a physical via video conferencing. So she's going to experience that. That's telemedicine, where you actually, it's kind of like the way I'm talking to you folks right now. It's like as if I was the patient or the provider, and then I was talking to you, and it's kind of like a visit. The physical exam is what's going to be limited, but usually if you get a good history, you can have a good diagnosis or differentials 70 to 90% of the time, as long as you get a pretty darn good history. So we're going to be exploring that next week, and I'll let you know about that if I remember next week. So that's with her school, and she's saying that she actually had a classmate who actually tested positive for COVID. She was admitted, and she's actually been discharged, and she's doing fine. And I said, "Well, how's work?" Because she works at the county facility. She says, it's pretty much dead everywhere else, but she said that her ward is actually filled with COVID patients. As a variety of COVID patients, some people have gallstones, gallbladder infection, and actually they get tested for COVID, and lo and behold, they're positive for COVID. So they have, she says, the units are full and with COVID patients, and so is the emergency room, which is to be expected in a county facility. But they're segregating the COVID patients and the non-COVID patients. So you don't see a lot in the waiting room. You don't see a lot in the lining up, but there are patients. Now, why did I even mention that? Well, she was actually saying that she doesn't know whether to believe that this stuff is really going on in New York, and she thinks that some of it may be fake news. And so she showed me a video on YouTube. It's actually, excuse me, it's a I have coughed into my hand because I'm here by myself and I just rubbed my tummy. So yeah, it's supposed to be like this, but I'm here. I'm gonna wash my hands in a little bit. I'm not gonna interrupt this. I think that would be rude. I can just wash my hands. I'm here alone anyway. So anyway, she showed me this video that actually is out of YouTube, and it actually is. It shows a young woman, probably in her 20s or 30s, maybe even early 40s, who was saying that what's really going on in New York, and so they do little montages of, like, they would do like a news report saying, oh, there's a very long line for people getting their testing, and then somebody would that would play, and then the next frame would be a guy walking around with his cell phone saying, where are the lines, where are the people? And then there's other montages where they go into a waiting room of a hospital, and the narrator, who's holding on to a camera, so it would seem that it was saying, where are all the people, where are the patients at? And then there's another scene where a guy is this guy who's holding a camera or a cell phone screams across the street at a person who looks like an EMT. He says, "Hey, do you see a lot of COVID patients?" And the EMT says, No, not really." And he says, "Well, how many have you seen so far?" And so the guy holding the camera says, "Oh, is it about 10, 22?" So the guy answers back, 3. Now, the guy doesn't ask specifically, the guy with the camera doesn't ask, well, how many have you guys seen today? Or, have you been on for a while? Right. So it's almost like, to me, it looks like fake news. Let's leave it at that. And then he goes to the container, the freezer container where they're supposed to be loading the deceased into this cold container, and he says, "Oh, look, here it is. There's the cold container." Well, yeah. They're insinuating that that this is all fake. Well, I suppose you know you can always say if you have your eyes closed and somebody says, "Here, feel this," this is an elephant, but all you feel is a tail, then and you don't know what else you don't feel anything else. You can say, oh well, that's probably not an elephant. You're probably just BSing because all I feel is a tail, and you're not really how can you tell me that this is an elephant when all I is a tail? For all I know, is it could be the tail of it could be a fake tail, it could be a pig tail, it could be a horse, it could be a a tail that has or like maybe a cow tail. So from that perspective that they're trying to present, it would seem that that's what's going on. But if you think about it, right, people are probably following the stay at home order, like and I think news outlets have been reporting that people have been staying home, which is actually what's helping bend the curve. Even in LA, if you were to look at the outside, you would say, well, there's no lines. Well, there better not be any lines because they're following the rules. And if you say, oh well, what are the long lines at Walmart? Supposedly there's a whole bunch of lines, but you know what? If you go early in the morning, you see long lines, but when you go late in the afternoon, shit, you just walk right in. There are no lines. So it all depends on when you get these videos, and those videos weren't really clear as far as what time that they were videotaped. It could be, and it could be morning, could be in the afternoon, could be before they even opened up. Right? They're not. Some of these places aren't 24 hours, especially out in the cold. Who's and cold and rain? I mean, who's gonna? Very few people are gonna do that, right? So from what my student was beginning to believe that this isn't real. But then I asked her, I said, well, I said, the hospital where you work at, is it really empty? She says, no. She says it's full. So then I said, well, so why do you think that this COVID thing isn't real? She says, well, I see videos like this. Now, mind you, this is a very smart girl, right? And and she's a master's prepared. She's about to get her master's degree, and she's been working as a nurse for a while. But these fake videos are so convincing to her that it's actually beginning to make her think twice that this may not be as big as the news media is making it out to be. But then again, she answers that yeah, her unit is full, the other units are full, yeah, and so she's kind of confused as far as where she thinks. And I said, well, I said, well, you just answered it yourself. I told her, I said, you can't expect people to be, business as usual in the waiting room, just trying to, just and they're like all COVID patients. That's because we haven't seen the surge yet, and so now it's anywhere between now and from what she said, May. So, which I believe it. I think it's just a little slower in LA than it is in New York. So I think it may not get as bad as New York. I hope it doesn't. Nobody wishes it will be that bad, but if it ever gets that close, it's gonna be a terrible day for LA and yeah, for a lot of people. So I think partly part of the reason why we're not seeing a lot of patients is because this social distancing and this self isolation and self quarantine is working. I even my own prediction was that about 2 weeks ago it was going to hit the peak. We were going to hit the peak, but I was wrong, and I'm glad I was wrong. So I think there were like little peaks, but the actual peak for like close to 40 million people in in California and about 13 million in LA County alone. It may be a slow to see whether we peak or we bend the curve. So, but the county has reported total deaths are now, I think, over 200, and yeah, so hospitals are beginning to fill up. So there are a couple hundred more that were diagnosed positive. So that's kind of us. And so we had a little bit of talk about that. We talked about the economy. She doesn't think that the economy that is gonna be bad for a while. But the things that she was saying, she says I don't want this to happen, but maybe with the way the economy is going to tank, she says I might be able to buy a house. I said most likely you'll be able to buy a house. I said, and but she says I don't think the economy is going to be that bad. It's going to bounce back in probably 2 to 3 months. I said I don't think so, but I hope you're right. And some of the things that I said was like, the airline industry, the restaurants, and people are just losing their jobs. Small businesses are losing their jobs. But then she says, well, there's that the stimulus, and I said, yeah, but you know what? That's just basically a loan for you to spend. So the government gives you $1,000. Well, guess what? Most likely you're gonna have to claim that on your taxes if you do get it. So if the poverty level is $17,000, and I don't know what it is now, and now all of a sudden you get $1,000 from the government, well, you're now out of the poverty level, and guess what? You're gonna get your ass taxed. You're gonna have to go pay taxes, and yeah, so yeah, whoop de doo, you were able to spend $1,000 that it was sort of like a gift, but now you may incur a bigger tax liability. So the people that may benefit are the ones that don't really have anything, that are way below the poverty level. And you know what? If you're way below that poverty level, you you need more than just $1,000. But you know what? Hopefully it'll help a little bit. So yeah, and I'm telling her, yeah, $1,000 isn't going to really, it's not going to help you for a month, let alone for like 3 4 months. So yeah, I didn't mean to be pessimistic, but it's maybe the worst case scenario, but in my line of business, you have to think the worst and hope for the best. So yeah, that's kind of what we were talking about. And then I actually, like I said, so she hadn't been back. She was on spring break before the COVID. Well, it's just the start of COVID, and she said that she thinks that she had COVID, and because she felt so bad, but they wouldn't test her. She still had to go to work, but she just had to put a mask on. So, and that's still the case. So, I showed her around that we have this new screening place, and I showed her the flow, the process flow, where a patient comes in and it gets screened primarily by the security guard. Second screenings by the provider, and I told her this is what you do. You walk the patient, you go to this room. Now there was one patient. Now it's been like this, right? So I talked to the nurse practitioner who was there, a colleague of mine. And I said, "Hey, so how many have you seen today?" She said four. She says we tested one. Oh, I guess. Oh, okay. So I saw a patient, right? There's still one in that room. So there's an empty room next to him, and I took her there, and I said, okay, this is what happens. You tell them not to touch anything, not to sit. And then you tell them that whenever this button rings, that you press that button, it'll be a speaker, and then you close the door. And then the nurses were heading towards me. They said, hey, they said, don't touch that. They said, we just tested somebody who for COVID in that room. And I go, they said, you didn't touch anything, right? We didn't. So we just went in and out, and we were only there barely like a minute, just showing her. And so there was no contact. We weren't in that room for that long. I just thought that I'd share that with you. It was kind of funny, and I hope neither her nor I will come down with any any symptoms. So crossing fingers. Yeah, I doubt we'll catch anything. We weren't there that long. We both had masks on, and we both had. I had a lab coat, and she had long sleeves. So yeah, she had a mask on too. So that was kind of like the day, and I it was just basically calling patients and and just emailing. A lot of them were just requesting medications by email, ibuprofen, stuff like that, and they're just refills, and then other just asking results, and had questions about medications and their health and stuff like that. So it's really it's been boring, and you know what, let it be boring, because I think the more boring it is, that means there are fewer patients, and when there are fewer patients, the better I think we're doing, the good, I think the better, I think we're doing a great job. I think if we start seeing a lot of patients, although the my colleague said she saw four, the average has been three, has been 2, 3. So if she saw four, so we might be getting an influx of patients coming in that may be uh, beginning to show symptoms. So our COVID testing, the turnaround time is now 24 hours or less. So the one we tested yesterday was negative. So the one that was tested in the car. So we'll see what tomorrow, what the results are tomorrow for today's individuals who were tested. So yeah, I think we're gonna. It's creeping slowly, but there's probably gonna be more and more patients as the days go on. So I thought I'd just give you guys this update. Um, I won't be on too long. So if you guys have any questions, if you guys have anything to share, I think we're just waiting for patients to come in, and like I said, hopefully we won't see that many. So all right, guys, stay safe, and we'll be together again tomorrow. Have a good night.